Hi, I am Ikram. Today I will present ST depression topic for my ECG course. Main discussion for this topic: definition of ST elevation, causes, sign and symptoms, ECG finding, location, and conclusion. Definition for this topic: ST depression is a downward displacement of the Saint segment below the isoelectric baseline on an ECG. It often indicates myocardial ischemia, reduced blood flow to the heart muscle, but it can also occur in other conditions.
Causes: cardiac causes, myocardial ischemia, most common, non-street elevation myocardial infarction, NSTEMI, unstable angina, reciprocal changes in STEMI, left ventricular hypertrophy, LVH, and bundle branch block.
For non-cardiac causes is hypokalemia, digoxin effect, tachycardia, severe anemia, hypoxia, and electrolyte disturbances. Sign and symptom: it's depend on the underlying cause and may include chest pain or discomfort, chest tightness, shortness of breath, palpitations, dizziness, excessive sweating or diaphoresis, nausea or vomiting, fatigue, tachycardia, hypertension or hypotension or signs of heart failure, in severe cases.
This is a normal 10-lead ECG. As we can see, the J-point or at isometric line on normal ECG that mark with red circle.
The next picture show ST depression ECG. ST segment depressed is greater than or equal to 0.5 mm below baseline at J-point and at least 2 contiguous leads.
And this is the 3 types of ST segment depression, which is horizontal, down-sloping and up-sloping.
For horizontal ST depression were most suggestive of ischemia, while down-sloping ST depression was associated with myocardial ischemia, and up-sloping ST depression were less specific but may still indicate ischemia during stress test. These are the common leads involved, which is V1 until V4 were anterior ischemia, lead 1, AVL, V5 and V6 is lateral ischemia, and lead 2, 3, AVF was inferior ischemia.
For conclusion, ST depression is an important ECG finding that may indicate myocardial ischemia, particularly in patients presenting with chest pain or other symptoms of acute coronary syndrome. It appears as a depression of the Saint segment below the baseline and can be classified as horizontal, downsloping, or upsloping. While ischemia is the most common cause, ST depression may also result from conditions such as electrolyte imbalances, left ventricular hypertrophy, digoxin effect, or tachycardia. Accurate interpretation requires correlation with the patient's clinical presentation, cardiac biomarkers, and additional diagnostic investigations. Early recognition and appropriate management of ST depression are essential to prevent complications and improve patient outcomes. That's all my presentation for today. Thank you for watching.